There are two forms of radiation therapy. External beam radiation therapy. This is the most common type. It involves an external machine emitting a beam of radiation that targets the treatment area. Different forms are available, depending on the need. High-energy beams, for example, can target cancer that is deeper within the body. Internal radiation therapy. There are different types of internal radiation therapy. Both involve implanting or introducing a radioactive substance into the body. Brachytherapy involves inserting a radioactive implant in or close to the cancerous tissue. The implant may be temporary or permanent. Another type of internal radiation therapy involves drinking or receiving an injection of radioactive liquid. The goal is to limit the extent to which healthy tissue around the cancer is exposed to the radiation. Doctors may recommend this treatment for prostate or ovarian cancer, for example. A doctor may recommend undergoing both main types of radiation therapy. The decision will depend on the type of cancer, size of the tumor's location, including the types of tissue nearby, the person's age, and overall health. Other treatments. Scientists continue to explore ways of improving radiation techniques to achieve more effective outcomes with the least possible risk. What to expect? The doctor will discuss radiation therapy and other options and help weigh the pros and cons. Before treatment starts, they will determine the right type and dosage of radiation. A person receiving external beam radiation may undergo a CT or MRI scan before treatment. This is to pinpoint the exact location and size of the tumor. A doctor may make a permanent but small mark on the skin to ensure that the radiation therapist will target the beam correctly. A person may need to wear a plaster cast or use a headrest or another device to ensure that they stay still during treatment. The first session may be a simulation, in which the team runs through the procedure. Many people have 5 sessions per week for 3 to 9 weeks, but this depends on specific factors. Each session lasts for around 15 minutes. Radiation therapy is painless, but there will be damage to surrounding tissue. This is why the treatment occurs on only 5 days per week. The 2-day break allows for some healing. A person who has internal radiation therapy may require an anesthetic before the doctor can implant the radioactive substance. Overall, several sessions and some time in the hospital may be necessary. The details of the process depend on the type of radiation therapy and the type and location of the cancer. Aftercare. After receiving external treatment, a person can go home and continue with their daily routine. However, they may experience tiredness, sensitivity around the treatment site, emotional distress. To help manage these effects, it is important to get plenty of rest, eat healthfully, talk to friends and family about any side effects, follow instructions, which may involve skin care, from the treatment team, avoid spending time in the sun, due to a risk of photosensitivity. Also, monitor for adverse effects and tell the doctor if they occur. The doctor may recommend additional treatments aimed at relieving these. People may need to speak to their employers about adjusting work schedules or taking medical leave. Uses. Doctor may recommend radiation therapy to kill cancerous cells. Radiation therapy can help shrink tumors and kill cancerous cells in the early stages. This kind of treatment, in combination with other appropriate therapies, can cause cancer to go into remission. In many cases, it does not come back again. Radiation therapy can also help treat symptoms when cancer has spread widely. At this point, the radiation is part of palliative care, which aims to relieve a person's symptoms and improve their quality of life. It may also extend a person's life, in some cases. Palliative radiation treatment usually involves lower doses and fewer treatment sessions than curative treatment. In some people with bone cancer, for example, palliative radiation treatment can help stop painful tumors from developing. Other ways that palliative radiation treatment can help include relieving pressure or a blockage by reducing tumor size, treating symptoms of brain cancer, such as headaches, nausea, and dizziness, reducing symptoms of lung cancer, such as chest pain and breathlessness, controlling ulcerating tumors, bleeding, and infections. In people with head and neck cancers, an obstruction in the superior vena cava can affect the return of blood to the heart. If you like the video, kindly subscribe in this channel. Baby Time FYI. Thank you.